Earlier this week, I told you that this market keeps giving you incredible opportunities, especially in the biotech space, because many of these stocks, they don't know when to quit. Take the turbocharged rocket that is Esperion, ESPR, the $2.3 billion drug developer that's been roaring like crazy in anticipation of his game-changing pill that's designed to lower the levels of bad cholesterol in patients who either can't take traditional statins or for whom statins just aren't doing a good enough job. Esperion's stock more than tripled last year, and from the start of 2015 to the beginning of this week, the stock rallied another 90%. Then Tuesday morning, the company announced some very promising phase 2 data for its anti-cholesterol pill, and the stock soared from 77 to 99. At that point, you might have thought that the run was finished. Not with Esperion. They filed a 1.75 million share secondary Tuesday night, and you would have been wrong if you thought it was over. This secondary priced at $100 per share, and if you got in the deal, well, you already made 10%. This is an incredible stock. So best of all, you could have easily captured these gains after we spoke to Esperion's CEO 2 months ago. Since then, the stock's up a staggering 125%. So we got to ask, can it really keep roaring? Let's take a closer look with Tim Mayleben. He's the president and CEO of Esperion Therapeutics. Hear more about his company and his terrific anti-cholesterol compound. Tim, welcome back to Mad Money.
Thank you very much, Jim. It's nice to be back.
All right, Tim, I've got to tell you, I've never seen it. I've never seen anything like your stock. And I have to believe that's because some people must think that your pill can either take the place of or add to all the people who take statins now, or maybe actually fill the gap for 8 million people who can't take the statins. Isn't that the only explanation for a stock that is going like this?
You know, I don't know the explanation for the stock activity for sure, but we are very excited about the drug that we're developing. It's got a particularly unsexy name, ETC 1002, but we think it is one of the most attractive drugs in development in the industry today because, as you said, it can lower LDL cholesterol not only as monotherapy, but also in combination with statins, as we showed earlier this week in a very, very positive trial. Not only is it efficacious on top of statins, Jim, but in addition to that, it was very safe and well tolerated. And of course, that's vitally important for patients who are taking a medicine like this or could take a medicine like this for the rest of their lives.
All right, but see, let's put myself in the shoes of the FDA, Tim. The Regeneron drug, you do not have to go to the doctor. You can self-inject it, right? And it works. And so far, the health profile is pretty good. Why would I say to Esperion, I got to fast track you when I may already have something and you guys can take your time, do it right? I mean, aren't you afraid that the FDA is not going to want to do Me Too with you and rush this?
You know, I don't think that we're looking to rush anything. We are very seasoned drug developers as a team at Esperion, and we have been developing this drug in a very forthright fashion, carefully, but also very quickly. And so we're not looking for the FDA to necessarily rush this. We are looking to move it forward, and we have been working cooperatively with FDA to do that. What we like to say is that we hold the radical belief that patients will prefer a oral once-daily pill rather than having to self-inject or go to their doctor for an injection. But I think the convenience of oral dosing is really important to patients who have to take a medicine like this for the rest of their lives if they have elevated LDL cholesterol.
And I just want to go over again, there has been no incidence of any sort that is any different from what Regeneron and Amgen experienced with theirs. In other words, no side effect that is any different from what those guys are. Nothing life-threatening, nothing.
So we are at an earlier stage. The only caveat that I would say, we're in an earlier stage of development. As you indicated earlier, Regeneron and Sanofi, as well as Amgen, are going to be up for approval for their therapies this year. But having said that, we have not seen anything of significance in our clinical trials. And in fact, the drug has been very well tolerated. In fact, you know, we've been saying as well tolerated as placebo, which, as you know, is a sugar pill.
Sure.
So very, very nice safety and tolerability profile.
Now, Tim, I know I was skeptical initially, only because Esperion 1.0 was acquired by Pfizer in 2004 for $1.3 billion. Did they not stop the development of this drug?
No, Jim, the original Esperion was focused on drugs to raise HDL, the so-called good cholesterol. This drug, it was discovered and patented at the original Esperion, but unfortunately, Pfizer did not work on it at all during the time that we were part of Pfizer. And when Roger, who is a good friend and colleague and co-founder of Esperion, realized that Pfizer was not working on it, he saw an opportunity to get it back. And so Pfizer effectively sold it back to the new Esperion, and we've been running with it ever since.
Well, this is Babe Ruth going from the Red Sox to the Yankees. And, you know, the Red Sox, I think, had a degree of remorse. Tim Mayleben, thank you so much. President and CEO of Esperion Therapeutics. Congratulations, sir. You came on. You got a lot of people who felt the courage of your conviction, bought the stock, and you've done terrifically, and I think it's not over. Thank you so much for being on the show.
Thank you so much, Jim.
Absolutely. Okay, what can I say? Esperion's not done. When you see this kind of demand after they do a secondary, people believe that this drug's going to be worth multiple billions. Who am I to disagree with them? After the break, I'll try to make more money. Booyah! Jim Cramer here from Mad Money. Thanks for watching CNBC on YouTube. Click here to subscribe and get the jump on my exclusives with CEOs, plus market news, investing advice, and a whole lot more.